want to be forever young. Do you really want to live forever?
One life,
forever,
one love,
and ever.
one soul.
Today's January 30th, 2020. I'm Brent and I'm here with Dr. Marco Quarta, the CEO and co-founder of Rubedo Life Sciences. They're headquartered in the Southern Bay Area in, I believe it's Sunnyvale, is that right?
That is correct.
Sunnyvale, California. We are in San Francisco, about an hour north or so, depending on driving, right? You typically use time when we're talking about travel in the Bay Area because of the traffic. And we are at the second annual Longevity Therapeutics conference here. And I just listened to a fantastic presentation that you gave.
Thank you.
And so without further ado, I'd love for you to share a little bit about yourself and the company and how you guys are tackling the problem of aging and aging-related diseases and going to help increase humans' health span and lifespan.
Yeah, absolutely. And thank you for the opportunity to share with you all a little bit about our story. So let me start a little bit with myself. And my background is in aging and regenerative medicine, and this is something I've been doing for a long time. Prior to starting Rubedo Life Sciences, I was at Stanford, where I did initially came from Italy, and I did my postdoc.
It's hard to tell, right?
I know it's my Texas accent generally is misleading, but and so I came at Stanford to do a postdoc with one of the leader in this aging regenerative space, which is Tom Rando. And Tom and his lab, they discovered and promoted this idea of the parabiosis, the idea that you take a young mouse and you stick it together to an old mouse. There is something in the blood of young mice that will rejuvenate the old mice, and in the muscle, in the brain, and this has been confirmed and proved over the past 15 years by many labs.
And it also makes the old mice, it also makes the old mice younger, which you said, sorry, but it also seems to make the young mice older as well too, right?
It's absolutely true.
I stumbled on my words there a little bit, but.
No, it's very, very true, and that's why we always need to be very careful of what we do and how we do what we search. There are many questions, right? Why this is happening? What are there factors that promote a youthful state in the blood, or we're rather diluting toxic factors in the old blood, in the young, and it's probably a mix of both. So you have a good point. So I did my postdoc there with Tom, and after that, after my postdoc, I stayed and directed my own research group for many years, where we were doing aging and regenerative medicine. But this is an interest of mine that probably, as far as back as I remember, I always wanted to do this. It was my mission. I was a little kid. I always tell this story because my mom recently reminded me, I forgot, but I was like 6 years old when I said, I want to cure aging.
Wow, that's incredible.
And that's something.
You know that's not normal in this longevity field. I interview a lot of longevity scientists, and that's not normal. Most of them just kind of figure this out when they're older in college or already in some type of biotech, so that's very unusual.
Okay, that's interesting to know. I never did a kind of survey of.
It's a question that I ask a lot of the people that I interview, and I'm curious about. Dr. Aubrey de Grey, for example, when he was very young, he always knew that aging was a big problem, and he assumed falsely that everybody else knew this and agreed it, but they just, for whatever reason, didn't worry about it. And then it wasn't until he met his now ex-wife that he learned that that wasn't the case. So I digress. Due to the interest of time, let's move on.
No, and it's a good point. So that's it. That's since then has been kind of one of my drivers. And maybe because I've scientists in my family and medical doctors, so I started very early. My first lab was the following year at 7 years old. I had my first lab in my room, kind of asking, borrowing or stealing the microscope from my uncle and the little chemist kit, and started to play around. So I've been looking for that for some reason as more my personal mission. I don't do this because I think it's it's not just but an exciting frontier of science or a biotech opportunity, and definitely this all of it. But it's more a personal a personal mission, and so I've been following from philosophically, scientifically, and pursuing this path of how can we change the trajectory of how we age, because I think aging is more dynamic than we think.
I definitely agree as well too. Coming to conferences like this and listening to all of these presenters, you kind of get that feeling, that it's really complex. Now, quick question. You say it's personal for you. Does this mean that you're trying to help, kind of save, for lack of better words, your friends, your family, help keep them young and healthy and vibrant? Is that a big driver for you?
It's one of the drivers. I certainly see, I talk more as a less naive little kid, but coming from a different angle, I definitely see the importance of doing those studies and developing new therapeutics around that. The reason is really by we don't do, I don't necessarily try to extend a lifespan with our studies, but it's really health span.
Right, that's a big thing we talk about on my YouTube channel. The good news is it seems impossible to extend health lifespan without extending health span, which I think is good news.
It's good news. I could counter argue that we can keep you living for a long time crippled. And that's not what you want. You can force someone to stay alive with modern medicine in certain situations. Doesn't that reflect to improved quality of life? Sometimes it's the opposite. And so that's why, because we are now experiencing the emergence and more the frequency of these age-related diseases that, it was not a problem. We didn't really experience on a social level and economically until recent times, and it will become a major burden as we grow and the society grows. So what do we do with an aging population that is getting more and more sick due to age-related diseases, so driven by whatever is driving aging and is making our bodies to lose functions and degenerate? So the point is, we want to live a long life, yes, but healthy. You want to reach your 90s and still be able to do the things that you want to think and the way you've been when you're younger. So that's important because in a way, has an impact on society. It will make healthcare more sustainable. So people that has less of a burden from an economical point of view in the healthcare, we can kind of add a generation to our society. Mm-hmm. People that, if you get sick, you don't contribute mentally, emotionally, economically. You are still productive, and not just on work-wise. You have experience, a lifetime to pass to the next generation. This can change the trajectory of humanity in a certain way, and maybe make it also wiser. That I hope we will have also a better impact on the planet, somewhat reducing footprint, taking care more of your life, because it will be a longer life to live. It might be a cultural shift, and that's how I see I could give my small contribution to this, evolving trajectory that we are, as a human being on this planet, are making right now.
Definitely, and I personally believe that if we do extend life significantly, let's just say maybe we push the limit, it seems to be the consensus of about 122 years right now. Maybe we push that to 150 in the short term in the next few years or decades. I think and I hope that humanity will value life even more. It will make us more human and not less. That's my personal, I might be a little bit of an optimist and a little bit naive, but that's what I believe.
Possibly. I think this comes with investing in a certain culture and education, distribution of wealth, and that comes with distribution of health as well. It may not be that obvious, but I think that, I don't know if we can, I believe that we can extend lifespan, but I think that this generation of longevity therapeutics, including what we're doing at Rubedo Life Sciences, is first extending health span, which might translate into living the same amount of time or having higher chances to reach your, let's say, 90s or 100, but being younger and healthier for a longer time.
Right.
And so if you think about this is a graph where, this is time, years, and this is a chance to get sick. Now people are like healthy, and then the chance to, or it depends how you want to plot it, or the survival. So the chances to be alive or healthy will decrease as you age until you die. What you can do with these technologies, with these therapeutics, is be healthy for longer and very quickly get sick and die. Pushing this longer, it's a different story. They can come together, but not necessarily. Because we are also programmed to live in a certain way. And I think it will come, but that might happen later, and it's probably a good thing, because I don't know if you're ready to have a population that will live longer. The other thing is then if you extend lifespan, then you may live healthier for, let's say, 90 years, and then you still spend 40 years sick.
Right.
You don't want that.
No. And a few minutes ago, when possibly I misspoke, what I meant was, right now we already have the problem that you kind of laid out. We have people living longer, but many of them are in a very decrepit and unhealthy state for many years, sometimes decades, and this is a big problem for not only them but their families, who have to support them either by time, physically, financially. And so I think what I was trying to say is that the only way we can significantly increase lifespan further than where we are is pretty much how you just described, by extending the health span. So I think a lot of people get fearful when they hear about extending the lifespan, maybe another 30 years or even more. They just initially think, oh my gosh, 30 more years in a nursing home, or no thanks.
Right.
So let's talk about the science. Let's talk about maybe a little bit about the company, when you guys were founded, what gave you this idea, how the team came together, and then the science of what you guys are doing.
Certainly. Well, the company, Rubedo, is an early stage company. So we started operation in the summer of 2018, so about a year and a half ago. And first about the name. So I chose the name from alchemy. So Rubedo in alchemy represents the last phase of the great operation, as so called, to realize the universal medicine that gives you longevity and immortality. And Rubedo means a phase in red. It's the last phase. That's why the logo is red. And the real
plus blood, right? So kind
of course, so there is blood, there is red, the symbol is a long story that I'm not going to talk, but it's somewhat all around those concepts, and definitely. And so I was very excited when a few years ago, now probably 10 years ago, there was this emerging idea that, for example, you can target certain mechanism of aging, and in particular senescent cells and like senolytics, that were promising to actually start doing something real in how you can manipulate the biology of aging. And I've been very excited in following that, as well as the other technologies, like the ideas that very promising are spinning out from this parabiosis concept, and many others. But at some point, it is behind Rubedo, there is the idea that the drugs that we are currently using or bringing to the clinic, they are not designed for geriatric people, for the elderly. We are repurposing. What the field has been doing is finding for drugs that we know they exist and repurpose them for finding use in different biologies, such as like senolytic to kill senescent cells, or inhibiting other pathways that like mTOR pathways and around the calorie restriction concepts, etc., etc. But those drugs are intrinsically have off-target effects, so they are toxic. And the toxicity of the most of the drug, any drug has toxicity, but generally the safety profile of the common drugs that have been developed for younger people, because that was our population, but until recent times.
Mm-hmm.
Now there is a growing population that is more and more developing these age-related diseases. But with age comes also changing biology.
Mm-hmm.
And geriatric people, old people, they have comorbidities. Now, after a certain age, you don't develop one. You have an exponential increase every year to develop one or more diseases.
Mm-hmm.
So you take many drugs, many medications, adding effects of several toxicities. So these people are frail. And small toxicities that the younger, healthier people, or just younger, even if they're sick, can tolerate, old people cannot. And so you can't now have therapies that are safe and maybe systemic. And aging is a systemic condition. Just looking at senescence is distributed across multiple tissues, and as we age, or depends on the disease, but that accumulates more and more. So you need drugs that are safe and tolerable and very effective and powerful, so you can very accurately treat those conditions. And that was the need that drove us. So I joined forces with my co-founders, Mark Gallop. He's probably one of the best medicinal and combinatorial chemists that I know, scientifically, and also as an entrepreneur. He started and led to the clinic several drugs in multiple companies. So he brought that level of expertise, and Julian Klein brought the expertise in senescence. And so that's how we started, and we generated this platform that is based from a discovery process that is start from a bioinformatic approach, combining a very sophisticated approach that can look across multiple ages, multiple tissues, multiple species, multiple level, from genetic level, epigenetic, metabolomic, histology, functions, with a question: is what are those cells that emerge with aging? Can we identify them? Can we look inside? Can we identify the unique ideas to learn what they do and how we can target functions that we need to change the way they work or the way they affect aging? And so once we learn that through this platform that is unbiased, that can be done to any cells, like senescent cells, cancer cells, stem cells, how do they change with age? Where do they come from? And so we learn this information that we use to design drugs. So our goal is making drugs that are customized for older people with a higher safety profile and very accurate, drugs that are inactive, and they are selectively activated into the target cells, targeting cells that are driving the aging process. So we have a senolytic program. Our aspiration is making drugs that can be used systemically, safely, and only kill surgically senescent cells where you want, or cancer cells where you want. We have those programs up and running and developing therapeutics for different indications with this idea. And so really, Rubedo Life Sciences is a drug-making company, but for geriatric people, drugs that are more precise and more safe.
Okay. Now, is there a certain age limit that you have for customers, or could anybody,
That's a good question. No, anybody can. Let's say that if you're younger, you can afford to take a drug that will lead to some side effects that somewhat your body can recover from.
Okay.
Right? Assuming that you don't have to take this chronically, and at some point you might have other problems. And it depends on the drugs, but most of the drugs, if not all, some are safer than others, but you can tolerate those effects, assuming that they can cure something else. But in the long run, they might lead you to complications. But when you're young, that's how humans are. We are, there is this, we are resilient, and you can buffer. You get sick, and then you go back.
Mm-hmm.
You get sick again, and you go back. But as you get older and frail, you lose this. So you get sick, and you don't go back. Your system gets damaged, doesn't repair. You
Mainly
shift.
the immune system, right?
We have to, yes and no. Yes, but I always like to think that we are, in an holistic sense. We are an organisms, and all the parts communicate with each other. So yes, immune system drives something else. It drives something else. What is causing first? We still don't know. Certainly, immune system plays a drastic role, mostly by driving this chronic inflammatory state, where senescent cells contribute in like driving this chronic inflammation. But let's say you push one side, everything else will follow. You remove one of those, everything will start to shift back. But as we age, we lose this capacity to compensate. And so if you take a drug later, that toxicity can have more dramatic effects than if you're younger. That being said, there are always side effects. So having a drug that is safer, even when you're healthier and younger, is always better. It can allow you to take the drug maybe more frequently, as opposed to be more careful how often you have to do it. So while we are now targeting old people to try to cure them from these chronic conditions that emerge with age, but in the future, once we prove that the drug is safe and effective in a certain, to treat a certain clinical condition, a pathology, now the drug can be expanded towards other things, ideally in a prophylactic way. Now, once you know that the drug works and has an effect in older people, you can start to take it younger and younger in order to prevent the disease. But you cannot make drugs to prevent disease. You have to make drugs to cure something. And then they can be repurposed in other ways.
Okay. Now, what I've found, and I really enjoy this, is that in the longevity community and even within startups, entrepreneurs, businesses, there seems to be such a strong sense of cooperation because we're all fighting this one thing called aging, essentially, which causes so many chronic diseases in those older years. And so you may or may not know this, but I've interviewed Dr. Maharaj. Are you familiar with his work? I interviewed him in October, and is there, with that in mind, do you view him, and Alkahurst had a presentation here at this conference, do you view those as, competition or cooperation or a little bit of both? How do you guys see that?
Oh, that's a great point. The beauty, I think, of this community is I can't talk for everyone, but in my experience, many of the people are really mission-driven.
Yeah.
So very few, or none that I know, but I would say the majority, they don't do this because it could be a good business opportunity, or it's a new way for therapeutics, or they're coming sooner or later when they discover that you can do something about aging. There is this excitement and this mission about doing something that can really help lots of people and at many levels. And so, and knowing that is extremely challenging. Aging is multifactorial. It's not like one silver bullet. It's not going to be that the case. So we need to be mindful that it's a marathon. It will take lots of efforts. And so, yes, you're right. There is this spirit of collaborations and work and help each other, sharing tools and ideas and resources, which I think is a little bit unique. So I do see that many of those therapies are complementary. Especially, I hope that many of them will reach the clinic. As I said, you don't make a drug to cure aging, not yet. There are ideas around, and even trying to convince the FDA to approve aging as a clinical indication. Nir Barzilai is working on that with a trial using metformin as a first potential drug that can do that. It will take a long time. But what we need are drugs that prove efficacy and safety to treat different things. Neurodegenerative condition, cardiovascular condition, diabetes, cancer, Alzheimer's, sarcopenia, frailty, etc. But at some point, they will all target what we call the hallmarks of age, different aspects that are, as we know so far, that they are driving the aging process. None of them can solve aging completely, if ever we will ever be able to do it. But certainly by adding in the future these different therapeutics, we could completely change the way we age. It will take probably an entire generation to do that, but we need to start. And so to answer to your question, yeah, I think this is synergistic. There are many therapies, and an example is for myself. I started Rubedo, and I'm driving it. But I also co-founded another company, Turn Bio, that is based on epigenetic reprogramming of aging, and is completely complementary. Is probably a completely different approach. I see like how strategies like that, the one like blood-derived factors, rejuvenative factors, biologics, and so many will converge, hopefully in the future, but it's a long run.
Awesome. I didn't know you were the co-founder of another company. I should mention this. I'm actually recently the co-founder of a company called LEV Sciences. The LEV stands for Longevity Escape Velocity. And it's a website where we're trying to get as many longevity thought leaders, scientists, researchers like yourself to join. We already have Dr. Bill Andrews on board and many others in discussions to join. But then we also want to get, longevity enthusiasts, people who aren't scientists, but they follow this, maybe watching my videos or on Facebook in groups who want to participate and see this research. So you don't have to give me an answer now. I'll include a link and maybe share a little bit more with you off camera. But I see a need for this because it's kind of like there's all this research going on and there's all these folks at a conference like this presenting their research, but I would love to see all of it come together in a platform to see that. Now, due to the interest of time, I always like to ask my guests, what you personally do to try and stay young and increase your health span and lifespan. So maybe share your thoughts on that briefly.
Oh, okay, that would be a long answer.
I know.
Imagine it.
Loaded question, and I say briefly, right?
Well, I'll try to be as comprehensive as possible in my lifestyle. That includes being physically. So what we know that definitely can change the way we age are actually very natural things. It requires a form of like education and discipline in a way. But what we know is that physical exercise and being active is probably the best anti-aging method that we have. So trying to be physically active.
What kind of exercise do you like to do?
It's a good question. So that's another conversation. Try to be active. I love doing martial arts.
Okay.
And that's something I've been doing since I'm a kid. So I practice and train and teach martial arts. But around that, I do my own workout, and including like physical strengthening and yoga, flexibility. I could do climbing and running. So I think you need to work on the cardiovascular level, on your skeletal muscle. That is a very important organ to keep. It's not just strength, but it's a metabolic organ. It's really balancing everything else. That's what when you get weaker, that the spiral of frailty comes out. You're weaker, your energy goes down, you move less, you get more weaker, and then you get cognitive dysfunction and metabolic dysfunction. You move less, you lose bone density. It's a spiral. And unfortunately, as we age, we start to lose muscle mass. So it's important to keep it up. Diet is absolutely, what we eat is making us, and there could be a very long discussion around diet.
Right.
But overall, I would say just everyone has different metabolism. So there is not a diet that is right for everyone. But with eating healthy, good quality of food, balanced, not too much, actually keeping more on the low side, and varieties, and that's the key. So investing in what you eat, making sure that you have all the nutrients and in the right balance, but good health, like quality of life in general. So keeping the level of stress low, emotional quality high. You want to invest in emotional and mental aspect. I do meditate, keep my mind very active, but that's my nature. Reading a lot, and being engaging, being curious, being driven. For example, one of the best for centenarians. That's not for me, but I think is relevant. It's interesting that it's known that in geriatric medicine, when people get that old, especially then they lose people around them, they're still alive, even if they're healthy. One of the most important things is to give them a purpose, because if they lose purpose, they will quickly die.
Right.
So, but that's true for anyone. You don't have to wait to be a centenarian. That's probably how you get to live that long, is also having a strong drive and being to a level of happiness, and so how you engage in life, it's super important. So I think it's so many factors. And before taking drugs and medicine, I think you need to take your own responsibility. And there are so many things that we could do to live a healthy and happy life.
Definitely, I agree. And personally, I started really researching longevity science when I was about 20 years old. I'll be 35 in March, and I started with researching centenarians and super centenarians and blue zones because I always like to find the root cause of a problem or start where the data is actually there and then work backwards. So I thought, why not look at the people who've already lived the longest and see what they do and then reverse engineer that. And certainly the things that you mentioned are a common theme. People have a strong purpose. I believe the Japanese language doesn't even have the word retirement, so it's no secret the Japanese live long.
Yeah, and I had my supplements are kind of important, so I have my personal recipe of things that I take in the morning, but again, it's personal and I'm not sharing because I'm not giving advice or taking responsibility.
And personalized medicine is a really important concept, so I think that's a good idea.
Yeah.
So maybe final thoughts. Let's talk about, you can connect on LinkedIn with folks. We'll have in the show notes below your LinkedIn profile, also the company's website. Are there any other ways that folks can connect with you or the company?
I guess the website, which is www.rubedolife.com, is the easiest and best way. So from there are some information and certainly a way to contact us. So if anyone is interested in, you can reach out to info@rubedolife.com and or to me using LinkedIn. That's a good way to do it.
Okay, perfect. Are there any other final thoughts that you want to share?
Well, I think I want to thank you for what you're doing. I think it's really important to create awareness and educate the community, not only the scientific community, but all the communities of what's happening. And that's going to take time and challenge and resources and motivation, but it's a collective effort. So it's definitely good to share and to involve and engage people into this, which is a mission, and it certainly is my personal mission.
Well, thank you very much. I really appreciate it, and I wish that I could find more of this content that I'm kind of creating on the internet, but that's the reason I'm doing it, because there's not enough of it. So as I've gotten older, I've realized that when you are frustrated about something because it doesn't exist, you just have to kind of put on your entrepreneurial hat and just create it. And that's what you're doing, and that's why I really appreciate the work that you and others at conferences like this are doing. And the world probably doesn't realize it yet, but we're so indebted to the work that you have been doing, and I'm sure the work that your team will produce for the benefit of humanity moving forward.
Thank you.
Forever young, I want to be forever young. Do you really want to live forever?
One life,
Forever
one love,
and ever.
one soul.
Untitled.